Hello, my name is Brooke Molina, and I'm a professor of psychiatry, psychology, and pediatrics at the University of Pittsburgh. I'm going to share with you some recent findings from our research program. We recently published a paper characterizing risk for stimulant diversion among teenagers treated for ADHD in the Journal of Developmental and Behavioral Pediatrics. Stimulant medication misuse has been fairly prevalent among college students and increasingly so among adolescents. We know that the most common source of stimulants for non-medical use is those who have prescriptions and choose to share, sell, or trade their own medication, which is what we define as diversion. But there's very little known about this diversion behavior and the risk factors. That's what this study is about. We've been conducting a randomized controlled trial of stimulant diversion prevention training in primary care. We used the baseline data for this paper to examine the adolescent behaviors, attitudes, and beliefs that might be important for understanding stimulant diversion. You can see we had 341 teens in this study, and they completed electronic surveys privately, as well as one of their parents. We have a conceptual model that we've been using to generate our hypotheses about diversion risk. This is in our paper. There are quite a few variables. These are some of them. Not all are in this model, but in the current paper, we examined these factors, their levels, their intercorrelations, and their associations with age. These include variables such as diversion, refusal, self-efficacy, which is one's self-confidence in the ability to say no if someone asks you for your pills. On the right side, you can see that diversion itself was actually quite rare in this teenage sample, which is good news. It means that we caught them before the behavior has escalated. We found that age was associated with risk, so that scores on many of our risk factors increased with age or was higher for the older teens. We also found quite a few cross-sectional correlations in these baseline data, suggesting that our presumed associations are generally on the right track. And then we put all of these variables in several models to look at whether they are associated in the ways that we hypothesize. And we did find some associations as predicted. We found that the teens' perception of negative consequences of stimulant diversion, being caught for diverting, was associated with intentions and their decision to share their treatment status. We found that their perception of schoolmates having misused or diverted was associated with their choice to disclose their treatment status or whether they had actually been approached to divert. You can see we had several factors here that stood out. It doesn't mean that the others aren't important, doesn't mean that these findings might shift when we study it longitudinally, but it does provide some initial support for our understanding of diversion risk. What are the implications? Well, currently, we think of the clinical implications as the following in the green boxes. We think that it's potentially important to educate parents and teens about negative consequences because it might eventually drive the teens' intentions as well as their treatment disclosure and ultimately their diversion. We encourage talking about the social climate that create vulnerability, reviewing medication use. Are there extra pills at home that aren't needed? And monitoring risk, alcohol and drug problems. These are behaviors that we include in our stimulant diversion prevention training, amongst other things, and ultimately our research will tell us whether this is effective. So I hope you enjoy the paper and reading more about the conclusions that we drew from our findings. We're very grateful for the support that we've received, not only from NIDA, but from all of our staff, consultants, resources at the university and the many participants across our diversion studies. Thank you for your time.